All right, now that we've talked about some of the symptoms of schizophrenia, let's go into some of the causes. And, again, you might recognize these from the previous two. So biological causes. There is definitely a genetic component, so a little bit lower concordance rate in identical twins than we saw with ASD or ADHD, but it does tend to run in families. So if a close family member has been diagnosed with schizophrenia, then you're more likely to develop it than if that wasn't the case. So they've done comparisons, adoption studies with biological and adoptive parents, and if the biological parents have it, their children are more likely to develop it. But also, again, brain-related things as well. So neural degeneration, so kind of breaking down of different neurons and gray matter in your brain. Reduced frontal lobe activity. So again, frontal lobe is that area that does a lot of the decision-making and judgments. So if you have reduced activity, you might not be able to make as accurate judgments about things, and you might start to believe things that are incorrect. But there's also a thing called the dopamine hypothesis. So this is the idea that dopamine, which is a neurotransmitter involved in kind of pleasant reward type of pathways, there's a hypothesis that excess dopamine might cause these hallucinations and delusions. But not every patient with schizophrenia responds well to drugs that reduce dopamine activity. So there needs to be a lot more research in this area before we can fully link dopamine to schizophrenia, but that is something that is kind of on the table. And then environmental as well. Extreme stress might be a huge factor. So people who are genetically vulnerable to schizophrenia and experience an extremely stressful environment, they might increase the risk. Also things like low socioeconomic status. So living in poverty might be a huge stressor as well. Having prenatal is before birth. So as your mother is pregnant, exposure to different viruses in the womb. And then also marijuana use, so drug use as well. So any of these factors combined with biological might increase that risk. Treatment-wise, again, starting off medication. So the main antipsychotic medications, so I'm just going to tell you a bunch of what things mean. Hopefully that helps. So anti is like opposite. So to kind of reduce the psychotic experiences, you might use something called phenothiazine, this word. So what this medication tends to do is it blocks dopamine receptors, kind of relying on this dopamine hypothesis. So this leads to less dopamine activity, but also some severe side effects because everything is side effects. And one maybe kind of phrase or word you might want to know associated with schizophrenia is tardive dyskinesia. Yes, words. So what this is, it's kind of tremors and involuntary movements that result from the use of these medications. So it might lead to kind of abnormal movements. One thing that you might associate with that, we know that Parkinson's disease, for instance, is kind of has a deficit of the basal ganglia. Basal ganglia involves a lot of voluntary movement and some dopamine to make that happen. So if you have less dopamine activity, you might have less voluntary movement. Also, though, there are some psychological therapies as well, typically psychosocial rehabilitation. So this is a treatment approach designed to help improve the lives of people with these disabilities. And the goal is to teach people emotional, cognitive, social skills that help those who are diagnosed with mental illnesses live and work in their communities as independently as possible. So its goal is to develop skills, use meaningful work. It's not a substitute for medication, but it helps those individuals kind of assimilate back into society. So I'm going to show you a video. We started off this kind of section talking about how schizophrenia is so commonly misunderstood. So now that we've walked through some text of what schizophrenia actually is, I'm going to show you a video from Britt Garner of SciShow Psychology, who is going to show you some common myths of schizophrenia and kind of give you another way of thinking about them. So I'm going to link that video down below.